Morning, everyone. Are these too tall? Are we good? Good to go? Great. Well, good morning, Queensland. In our COVID update, I can advise that, it'd be good if I had my book the right way around, 4,114 new cases to report. 2,588 of those are rapid antigen test results. So thank you again to those Queenslanders who continue to register their positive results from their rapid antigen tests at home. We've done 5,771 tests in the last 24 hours, and our total number of children that have been reported as positive between the ages of 5 to 17 have been 1,360, which is a slight decline from yesterday, which is great news. Sadly, I can report 6 deaths today that have been reported in the last 24 hours. These individuals are between the ages of 60 and 80, and the Chief Health Officer will discuss those in more detail shortly. In relation to our hospitalisation, we have 384 in public hospital, 34 in ICU and 17 in private hospitals. A slight increase in the public hospitals, but as the Chief Health Officer has said every Monday, that we always see those numbers a little bit higher because of the discharge practices over the weekends. Our vaccination rate now sits at 92.24% first dose and 90.61% double dose, which is great. I still would like to see our child immunisation rates come up. We are like many other states across Australia where we are seeing around 50%. We are at 42.08% of our 5 to 11 year olds. So we are not even at the halfway mark of our 5 to 11 year olds being vaccinated for COVID. So I remind parents our vaccination clinics are still open. You can walk in, you don't need a booking. You can also walk into community pharmacies, or you can make a booking with GPs to get your child vaccinated. And our 12 to 15 year olds, we are still sitting at 76.88% first dose and 70.38% double dose. I am pleased that we over the last couple of days have reached over 200,000 5 to 11 year olds. We're sitting at 200,001 and 460, so 201,462 children, but of course we need that to be over 400,000. And our boosters now sit at 63.11%, so we've now had 1.896 million people receive their boosters, which is fantastic, and 9,848 in the last 24 hours. So what we know is people are still coming out and getting their booster, which is fantastic news, but we're not seeing the vaccination rates in our young people at the rate that we should. And the very positive news I can report today that our staff who are positive or close contacts who are out of the workforce currently across health and ambulance services is down to 1,361. That's down from 1,817 just a week ago, and we know our peak was over 6,000. So I'm really pleased to see those numbers coming down, because that means more health workers back in our hospitals and paramedics on the road. I'll now hand over to Dr. Gerard.
Thank you very much, Minister. So today we sadly have 6 deaths to report, 2 people in their 60s, 1 person in their 70s and 3 people in their 80s. 1 was unvaccinated, 4 had received 2 doses of vaccine, and only 1 had received the booster. One of these individuals was an aged care resident. That brings it to a total of 241, the number of deaths in aged care. And our thoughts again with their families. In terms of hospitalisations, we have 384 people in our public hospitals as of last night. That's up slightly from the day before when it was 365, but as I've said on numerous occasions, there is this 7-day cycle, and we usually find that it doesn't start to stabilise in terms of the numbers we present to you today until about Wednesday, because of changes in the discharge practices over the weekend. So I'm not concerned about that. 34 patients in intensive care in public intensive care units. It was 33 the day before. In private hospitals, 17 patients with COVID, down from 21. on Sunday, and in terms of COVID cases in school-aged children, 1,360 cases reported in the last 24 hours, down from 1,381. And again, I can tell you that there has been no increase in hospitalisations among children in the last 24 hours, and no increase since the opening of schools exactly 2 weeks ago. I'll now hand back to the Minister. Thank you.
Questions? No? We all good? Sure, yeah. Well, people shouldn't be making that assumption. We're having those discussions this week about just the restrictions that we do have in place. But I know over the last few days when Victoria and New South Wales have announced some of the lifting of restrictions in their jurisdictions, we have been asked, well, when are we going to do the same? Can I be very clear? Victoria and New South Wales restrictions that they're lifting really brings them into line with where we have been throughout December and January. So many of the restrictions, working from home, density limits, we have not had density limits for some time now here in Queensland. Not needing to scan into shopping centres and that, we lifted that a week or two ago. Dancing and being able to go to nightclubs and singing, we've had those restrictions lifted for some time. So it really is about the southern states have brought themselves more in line with Queensland to this point. I know there's discussions and there's announcements around potential lifting of masks in certain settings interstate, but I believe that they're still to be finalised. So we'll have our discussions this week. The Premier made it clear that we would let everyone know by the end of the week, or the end of the month, sorry, and we also said the same thing about our elective surgery. So far, can I say, things are looking on track that we can lift our restrictions on elective surgery in our hospitals. Some of our hospitals have already been bringing some of their elective surgery online in individual cases, but our statewide suspension of elective surgery is still in place till the end of the month. So I'm really hoping that when I talk to all the HHSs over the next few days and senior leadership in health, that they're going to be able to say to me that we can get back to having elective surgery. It'll probably be phased in, but we will have more to say about that in the next few days. Look, we'll look at all of those measures. This is what the health ministers across the country are talking to the Commonwealth about. Here we are again in the same situation of basically pleading for the Commonwealth to recognise that COVID is not over. That there is ongoing pressure in our health systems. Our health systems here in Queensland have done very well to manage that pressure, but that pressure is there, and that pressure is not going to go away. We're going to continue to have COVID patients in our hospitals for some time to come, and that's on top of our ever-increasing demands. So we do need the Commonwealth to recognise that the changes they made around COVID and health funding needs to continue well into the future, and they also need to be talking to us about long-term reform on health funding, both in the hospital system but also to primary and allied health care. So we are saying we're going to need a lot of support to deal with the backlog of elective surgery that we're going to have, and I expect the Commonwealth to play their part and step up and support us in doing that. Well, that's just not accurate. Not accurate at all. We work with all of the health professionals, all of the stakeholders. We work with the Royal College, we work with the AMA, we work with the Pharmacy Guild, we work with all the peak bodies to make sure that we have the best and robust health system in this state. And I appreciate the support that those stakeholders have also had with us calling on the Commonwealth to inject more funding in a whole lot of areas, including mental health. So, it is not accurate to say that the election commitment we made to look at full scope with pharmacies has anything to do with donations. And the fact is that we can be very proud of our electoral system in this state, where everyone knows how much is being donated, who that donation is coming from, and who it's going to. And we have the best and the most strongest laws in the country. Considering that the same stakeholders can be giving donations of $14,000 plus to federal candidates or members or political parties, and no one would know about it. I'm pretty proud of the system we have here, where all donations of $1,000 or more are declared. Now, I also, and in real time, you're not waiting 6 or 12 months, you're seeing it in real time. I also have said previously, when it comes to the scope of the Pharmacy Guild, the scope has not been finalised, it has not been announced. The stakeholders are aware of it because they sit on a working committee with us, and we have shared the draft scope. But also, this is not new. This is being done already in the UK, in Canada and New Zealand, and we know that it can, if you get this right, help the community get better access to health care. And with such a decentralised state, I think that's a sensible thing to consider. Thanks, everyone. Thanks, Michael.